So very good afternoon and thank you very much. So I'll be just rushing my talk. So Visumax Smile Pro, the faster is better. So this is the new baby in our hand. And for people who have not been not been doing Smile, just a quick recap. So basically, essentially in Smile, we are creating a lenticule which is extracted through less than 4 millimeter, and we are now doing almost like 2 millimeter incision, as against the standard LASIK surgery where the hinge itself is just 4 millimeter and the rest is the cut. So Smile basically essentially involves 4 basic steps. So you have a lenticule cut, you have a lenticule side cut, you have a flap cut, and then you have a flap side cut. So just watch carefully. This is what we had, this is what not now we have, and just watch the two procedures going in. And believe me, this is just 8 seconds in a zip of a blink, and you have the whole procedure done, as against the 28 seconds or the 30 seconds standard that we were doing with the Visumax 500. So gone are those days where we actually used to have those suction losses, tachycardia, and blowing of adrenaline into our system. So what Visumax 800 has given us is this is the latest generation femtosecond laser, and what has made the change is this 2 megahertz, the laser source. So this basically has transformed into two major things. So easier tissue separation. So there is a reduced laser time, and this also makes the tissue separation much easier with the Smile Pro. So it creates the lenticule in less than 10 seconds, and for a flap it's less than 5 seconds, and this is basically because of the faster laser pulse repetition rate and the scanning speed of almost 2 megahertz as against the 500 hertz the machine was. So shorter suction time, which increases the peace of mind and reduces the stress of the patients during the laser treatment. So this is how the workflow basically involves. So you have this the arm, the laser arm swelling in, and with this the beautiful joystick control. And these are these ultrasound sensors which actually assist in actuating these robotic arms, and then comes in the microscope. And this is a wonderful microscope that the Zeiss has gone with variable controls in it, and the lenticule can be easily extracted. So this is what we've been doing now. So this is the visual from once the patient has been, the paint draped and the speculum applied. So this is the joystick of the bed, which is hardly taken into consideration. So I'm seeing through the microscope adjusted. Then you press the laser microscope, which swirls down, and this is the joystick here. And once you have switched on the board, the joystick, the moment you start moving in, and this is the laser component which moves down, and you see on the side the cameras here. And once this is there, this is the interface, and this is just, it's a magnetic. The moment you touch it, gets hooked on, and then you have the screen on here. And this is the center align and the torsional line, the cyclo align here. So very carefully, if you see here, the patient is looking out of the green light. You ask, and even in dilated patients, the patients can be well taken. I'm talking here, the XY coordinates from the atlas can be fed in, where the XY components, so directly the angle kappa based treatments can be done. And watch carefully, this is an unedited, just 8 seconds is the total time, just blink, and the procedure is complete. So gone are those days where we actually used to just wait and look at those tables where the suction loss occurred and how to tackle those conditions. And just watch carefully with the recent 1.2 software upgrade. What we now have is 3 micron separation for the lenticule and 1.5 for the side cuts. Just watch carefully as I go in. It's almost a free floating here, so I don't have any it's just a very smooth dissection on either side. Just watch now. I just go left, leave a stump there. I go right here, and it's a very smooth dissection either ways. And the lenticule can easily be hydrodissected, thanks to Gaurav for teaching us. And this is the whole surgery. Just few minutes of a laser application and few minutes of the lenticule extraction, and wonderful workflow. This is the day one picture. Hardly any visibility of the side cuts or the laser marks. So the two beautiful aspects of this is the cyclotorsion alignment. So watch carefully. Once I've docked in here, I can on the fly rotate and then align the cylinder. Shortly we'll be aligning it with the IL Master 700 and with the Forum software, which will give us this the cyclotorsion adjustment. And similarly we have this ocular align, and just watch carefully. So as we dock here, the XY from the Atlas has been fed, and automatically it aligns accordingly onto the vertex position. So the various competitions available. I think this is the fastest lenticule separating machine. So the two basic concerns with the smile were, the two basic concerns with the smile were the challenges and complication of lenticle extraction. The beautiful paper from Dr. Tatyal explaining it. So, and the second was the suction loss. So the treatment time with VisuMax 500 was almost like 28 to 35 seconds. And the various multi-center studies showed the suction loss to be close to 1.34%. So I think gone are those days where you have just less than 8 seconds of a treatment and very smooth dissection of the bed. So to take home message, it's a better refractive results, quite predictable and very easy onto the patient and onto the surgeon. Thank you so much.
Thank you very much, Dr.